The $7,200 that we're hoping to raise is going to be, we want to use that to provide incentives to women to make the transition to long-term HIV care. Pregnant women tend to be very compliant with HIV treatment while they're pregnant because it carries the promise of having a healthy baby. After the birth, when the baby has already been determined to be HIV negative, there's far less incentive for women to continue on the treatment for their own health. They tend to be very healthy on average because they were well enough to be able to get pregnant, and so they don't feel the effects of the disease for themselves. So we think that if we can provide them with the incentive to make that first visit into long-term care, then we've got them and we can really help them stay in care long-term, both for their own health and so that they continue to care for their children. In South Africa, as within the United States, pretty much everyone has access to a cell phone. And so one of the easiest and safest ways to provide an incentive to women to make that transition is to provide them a short-term incentive in the form of a cell phone voucher, about 50 Rand, roughly the equivalent of about $5. And so we'll use this money to provide the incentives to develop an infrastructure to be able to deliver those incentives safely and securely, and to work with the clinic to improve their systems to be able to track retention from care for pregnant women to long-term HIV care.